Okay, rinse it. Okay, rinse it. Why we need to rinse the paste?
So that will be moist, ma'am.
Moist. When the patient, okay, brush his teeth, it will be moistened. Okay, so tell to the patient, hi, Mr. David, I will assist you for doing oral care. So what you are going to do, Mr. David, is to, for example, I'm the hand of Mr. David. Mr. David, brush the, starting from the crown to, ano tawag dito? Crown to the gum line. Okay? Gum line. Okay? Then, crown and gum line. Then, inner and outer. Inner and outer. Then, the biting surfaces. Like last yung ano. Biting surfaces. Then, biting surfaces. And lastly is the
Tongue.
tongue. Okay, tongue. Mr. David, you can rinse. Get the
Kidney basin.
kidney basin. Mr. David, you can rinse it. Rinse. Okay. Then,
Dry the
okay, Mr. David, do you want mouthwash?
Yes. If he wants one.
Oh, if he wants, then you can give him mouthwash. Okay. Put in a small container. Then, okay. Then, Mr. David, do you prefer to have ano tawag dito?
dental
Dental
floss.
floss. How many inches or centimeters?
6.
4 to 6. Okay, so just get 4 to 6 inches of this and then put in the in between the teeth. So he will do this. So finished. Then lastly is most of the patient lips is dry. So offer patient if he wants lip balm. Okay, so Mr. David, you can put lip balm. Okay. Okay. So that is all about
Oral care.
Any question? Conscious, very easy. Question.
Wala.
Dali lang, ha? You know how to brush your teeth. The same thing what you're going to do with a independent patient. Okay, now we will assist the patient. Can we have a pillow with it? Okay, we will assist the patient into supine position. Okay, remove this, remove this, and then no need to cover the patient because we are going to do the next step, which is the unconscious patient. Okay, now for unconscious patient, oral care is very, very dangerous if you will not do it properly. Okay? Why you will not do it properly? Why? Because the patient might have what?
Aspiration.
Very good. The patient might have aspiration if we will not do it properly. Okay? How we will do it properly?
Position the lateral.
Very good. We will position the patient into lateral
Position.
Okay, now we are going to position the patient into lateral position. Okay, Mr. David. So what we are going to do, actually, what we're going to do, if you're placing the patient to lateral position, just put
Move
just move the
the
patient on this side and then this side. Okay. Okay, now 1, 2, 3. Okay. Then you can just put the pillow, okay, but put like this, here on, okay, to make it stable. Then what we are going to do is we will put a protective. You can put this or a towel, okay, but better this one so it's disposable. So we will put here. Then we will put towel here. So can see. Okay. So guys, doing any procedure with unconscious patient, you should ask permission always. Okay, don't think that this patient is not talking, unconscious, comatose, so you will not talk. You should always tell the patient, Mr. David, what we're going to do is we should clean your mouth. Okay? So even the patient will not answer, okay, you should tell it. Even you finish the procedure, Mr. David, I finished the procedure. I think I hope everything is fine. Then we will turn you into supine position. So you will still instruct the patient like that. Okay, it's not allowed to just do whatever you want. Okay, why? What's the reason?
He can't hear now. He can't hear.
The patient still can hear. When the patient will become conscious and awake, she will point on you. This is rude. This is rude. Okay, this is violating my right as a patient. So you should always explain whatever you are doing to any kind of patient. Okay, now we are going to do this. What we are the things that we need to put in a bedside before doing this.
Your equipment, the material for the
What
staff.
is the most important one?
The kid.
That should be very good. Suction machine. Suction machine should be on the bedside, okay? Or make sure the patient is with the suction machine before doing any procedure. Okay, what's the reason?
To prevent aspiration.
Aspiration, because the suction machine will suction the excess secretions. Okay, by the way, any patients who is unconscious, comatose, okay, there's a lot of secretions. And that secretions can go into your lungs and cause aspiration. Understood?
Yes,
Okay,
ma'am.
now what we are going to use is we will not use it. Actually, in the video, okay, if you see, okay, it's not being used in the hospital. What we are using usually is the toothpick. Why? Because this patient, okay, the unconscious one, they are very fragile skin, okay, or their skin is sensitive already. Why? Because they are unconscious.
Yes, ma'am.
Okay, so we are using the more
Soft.
friendly to the skin. So this is called toothpick. Toothpick. Okay? Toothpick. Toothpick, not toothpick. Not toothpick. Toothpick.
Toothpick.
Toothpick.
The word teeth plus THE.
Okay? So we will use toothpick. Okay? We will use the toothpaste. Okay? We will use this. Actually, we need tongue depressor. This is tongue depressor. We don't need this. Okay. The patient will not have meat on between the Then this one, and we need torch actually. Torch. Then we need this. This one. This is called suction catheter. Okay? Suction catheter, specifically we are calling it as, ano nga ba to? Sige, nasa dulo ng dila ko. We are calling it as, later. I forgot. No. Later. Ano ko na kanina. Anyways, so what we are going to do is we will connect this. Okay? Make sure that this one is open. Okay? Connect this. Okay, put this. Okay, we should have this, and we should have sterile water. Okay, normal saline. Okay, this is the one we are using. So you pour the normal saline here. Okay, and then we clean first. We flush first this one. So you open this. Okay, you open this. Usually up to 120. Then it's not we cannot. So we open this. Okay, and then flush this one. Make sure it is open. Okay, so if we need for the patient, we will use it. Now, so we are already prepared the suction machine. Now, what we are going to do is, what if the patient is biting you or it's very difficult to open? You put a oral
Oral.
airway. Okay, what is oral airway? You saw it in the video. If you watch the video, okay, you put it inside, okay, usually on the side. So, if the patient, if we are doing the oral care, okay, it's open. Because some patients is very stiff, okay, or some patients have biting capacity, their reflex, biting reflex. So what they are doing is they will do like this, even they are comatose. Okay, so you will put oral airway on the side to keep it
Open.
okay. Make sure that it is like this, okay, not like this. So why like this? Because so the
The saliva
secretions will go. Okay, now how we will open it is by how we will open the mouth.
Tilting the chin down.
Using your
Thumb.
Okay. Okay, the pull down the lower jaw like this. Okay, like this. Don't do like this, huh? I saw my students doing like this. Okay, what you're going to do is pull like this
The
and
chin, no?
do suctioning. Okay, with the excess first. Okay, so when we put it. Okay, then flush.
Kuha ko. Yun
Now,
ang hindi
there is
kasi
water
nakatak.
here. There's water here. First is we need to inspect the mouth using the torch and using the tongue depressor. Okay, why we are going to assess it? Because we are going to assess if there's abnormality. Some patients, they will develop fungal infection, sores, or candidiasis, or any infections in the mouth. So you should assess. So for your assessment, if you assess, you should give to the nurse, and the nurse, of course, will inform the doctor to do what is the treatment. Okay? We are not doing only the interventions. We are assessing also. And if you have a keen assessment, you will be a competitive nursing assistant. Okay? So what we are going to do is we should
Ma'am, pwede mo pang excuse saglit. Kunin ko lang po kung hanggang anong oras kayo dito, like schedule nyo.
8 p.m. hanggang 8 p.m.
8 a.m. to 8 p.m.
11 a.m. to 8 p.m.
11 a.m. to 8 p.m.
Apa. Ano na po si Sir George, sir?
Wala pa ma'am, kukunin ko po yung mga schedule ngayon, tapos ayusin po lang namin yung mga room para sa next ano po. Pipix ko po kayo dito ma'am ng 11 to 8 p.m.
Oo. Hanggang next week yan? Next week?
Okay.
O ngayon? Next week din dito kami.
Lahat po?
Oo, lahat. Same.
Hanggang lahat na
11 to 8 p.m.
Opo, tapos anong batch yung mga yun ma'am?
Batch 9.
Lahat po batch 9?
Lahat
Hanggang ilang weeks pa po kayo dito ma'am?
Hanggang March 5 ba tayo? First week. March 5.
March 5. Sige po ma'am.
Thank you.
Ano, paalis muna ka.
Anyways, okay, so you will assess it. How you will assess it? Why you are using it? Because you will assess the gag reflex. What is gag reflex? G-A-G. Okay, gag reflex, when you put your finger, okay, posterior to your tongue, okay, you will vomit, right? Yes. It means that you are a normal person. For those patients like this, okay, they will not have a normal gag reflex, or usually, if they have gag reflex, it's very weak. Okay? If the patient is developing a gag reflex, it means the patient is becoming better. Why? Because it's a normal mechanism of a person. So if he's developing a gag reflex, the person is becoming normal. The patient is improving. Okay? So, that's why we are assessing. And we can use this to assess the other part of the mouth. Okay? So, don't use it to other patients. Throw it. Okay? Throw it. Then, now we'll do the procedure. So, pour this with water. Okay? Then, put paste on the two teeth. Okay? Put paste on the two teeth. Then, same technique. Okay. What we are going to do is with the crown to the gum line. Crown, then the gum line, then inner to outer, then biting surfaces, Okay, and the last is the
Tongue.
tongue. Okay, tongue. Okay, then how we will pour this with water, not like this, huh? You cannot do like that. So what we are going to do is aspirate, okay, water from the glass, okay. Then pour from here, from up to down, okay, up to down. Make sure that the patient's head is down, okay. So it's pouring here, okay. Pour.
Up to down.
Okay? Then, of course, don't forget to suction because there is excess secretion. Okay? Okay, usually we're not, we can put, asan ba yun? Yung ating ito, chlorhexidine. Okay, we can put chlorhexidine also. We can put chlorhexidine here, okay, to put, and then you can rinse. Then, this one, no need. Okay, the patient is not eating meat or any food causing, ano. Then, dry. You can use another 2 teeth or you can use your finger to put here. Okay? So that's all for
Unconscious.
Okay, we can remove this. We can remove this. Throw this. Okay, throw this. And then we